Let's go to a male that has some specific risk factors, say cigarette smoking, or on a calcium channel blocker medication for high blood pressure, or has had significant obesity that could affect the sperm count. How long do you feel it takes to start getting a recovery from the types of agents that could affect fertility? And what are the other agents that may be affecting their sperm analysis?
Well, that's one thing that will come out in the history, because the history will focus primarily on those risk factors that the husband may be exposed to that could be having an influence on his ability to be fertile. And if there are sort of specific medications or toxins that could be affecting sperm production and it's determined to do so, such as calcium channel blockers, antidepressants, some of the recreational drugs like marijuana, cocaine, then initially you want to have the husband stop that kind of exposure or modify it with their primary care physician if they're on prescription medications for another reason that's affecting their fertility. A common one that I see now in at least my practice population is the exposure of men to testosterone, because testosterone is so readily available that a lot of primary care physicians, internists, endocrinologists are prescribing this for low energy, low fatigue, which you see advertised and promoted on TV. And it definitely can address those symptoms, but most of those specialists are unaware of how it affects fertility. And with most couples postponing establishing a pregnancy now into their third and fourth decade of life, it's not uncommon for me to see husbands come in on testosterone, unable to establish a pregnancy because there's no sperm in the ejaculate because they're on testosterone. So in that case, you stop that form of therapy, which is having an adverse effect on their fertility potential, and it can take anywhere from about 3 to 6 months to see what kind of sperm production develops after they've stopped that treatment. In the interim, then typically what I'm also doing is trying to figure out why they were on the testosterone to begin with, because sometimes there's some underlying causes that haven't really been identified or addressed that can be addressed at that point while that husband is attempting to restore his fertility.
Well, excellent point, and we see so much of that, the primary care physician trying to help the male with decreasing libido or a borderline low testosterone, but they really could be hurting.
Correct.
Yeah. What is the chance that a normal sperm analysis could result in poor fertilization, and in particular if we advance to in vitro fertilization, the chance that we didn't see that in advance?
Yeah, one of the challenges, at least in evaluating the husband, is that the cornerstone for the evaluation is the semen analysis. But it's not an absolute test. So the semen analysis, unless it's zero, doesn't really tell you whether that patient is fertile or not, because those thresholds currently don't exist. What they do tell you is what's the probability that a pregnancy can develop. So even if, let's say, there's a high probability of establishing a pregnancy based on the semen analysis that exists, then we do know that there are sometimes more subtle issues that can compromise fertility with how the sperm is put together, or how the DNA is organized, or how the sperm is going to function, that can be keeping that couple from getting pregnant naturally, but also could have some ramifications, even if you do assisted techniques. So it's always best to know that that's there, because obviously since in vitro fertilization isn't 100%, you want to make sure that the couple has reasonable expectations going into the cycle, but also be given the opportunity to potentially address that, correct that, so that when they finally do the in vitro cycle, they have the best chance of it working.